Now we have our chief guest, Professor Indra Rama Rao, and I'll take 2 minutes to introduce ma'am. She is the former president of Indian Sociological Society. She has also served earlier as secretary of the Indian Sociological Society in 2014 and 15. And ma'am is currently the honorary president, Alumni Association, Department of Sociology, University of Mysore. Madam is well known for her works on gender issues in forest management, girls' education, building capacities of women in local self-governance institutions. She is also a columnist in leading Kannada newspapers, and her major works include themes in sociology of education, studies in Indian sociology, gender and society in India, as editor in 2 volumes, and many Kannada books on sub-themes on feminism, women and culture, and research methods. Ma'am is an honorary adjunct professor at the University of Iowa earlier. This is in Midwest, US. She is also a contributor and editor of subject encyclopedias, dictionaries, journals, theme-based books, and translation projects. She heads a team that translates a great sociologist, Anthony Giddens' work on sociology into Kannada, besides being involved in many other translation projects and also evaluation of forest programs in Karnataka. Thank you, ma'am, for agreeing to be the chief guest. And she will speak on internal migration during COVID-19 pandemic. Over to you, ma'am.
Thank you, Dr. Ajaylu. Good morning to all of you. Professor Rajshekhar, Professor Paramjit Singh, Judge, President of ISS, Professor Chandrasekhar Bhatt, Dr. Munir, all my colleagues in ISS, the University of Hyderabad, student friends, and colleagues from across the country who are here. Thank you for this opportunity to be part of this event, which is so important in understanding the crisis situations that we are facing. I understand that there is a restriction on time because you have another session that has to start at 12 o'clock. So I'm just making a very brief presentation. I've just put my thoughts on paper because I'm one person who generally likes to speak, but I want to make sure that I just don't overshoot the time. Well, today, I would like to speak on a few aspects of internal migration, and Professor Judge in his inaugural address has referred to some of those issues already. So I just would share with you some of my thoughts. And I thought I would divide my presentation into two sections. The first, talk a little bit about the situation of the migrants, and also end it by talking about what options are available to us for policy. Because we cannot just be talking about problems, but there is also a way of coming out of these problems. And I think that as students of sociology, we have to discuss that, because I have always believed that sociology is action. And so we have something to give back to society. So I'll start by saying that we all know, of course, that the migrants have borne the brunt of the COVID-induced, upheavals that we have seen. And I just want to start by saying the word migrant is not as simplistic as it is made out to be. Because I think in the context of COVID, what I want to say is, in a broad parlance, the migrant group in the context of COVID could be divided into 2 categories, internal and external. However, within each of these 2 groups, there is no homogeneity. When we just talk of migrants as if it was a homogeneous group of people. Yeah. But we have to be very, conscious of the fact that it's not a homogeneous group. I would ask a very basic question, and that relates to the choice factor in migration. What I want to say is, among the groups, both internal and international migrants, there are migrants by choice and also migrants who chose to leave their homelands because of various forms of deprivation that they were experiencing. Again, both in external and internal migrant groups, there are differences of class, caste, gender, region, religion. And so the impact of migration cannot be understood disregarding the social categories in which the migrants are placed. So in my brief presentation today, I'll confine myself to a few issues that need to be focused, both, as I said, in understanding the situation of migrants and also working out a possible policy option. And to start with, estimates regarding the number of migrants differ from one data source to the other. But the World Bank, in a recent report, has said that about 40 million internal migrants are affected due to the lockdown which was brought into effect to contain the pandemic. Well, in the very first phase of the lockdown, when all support systems collapsed, neither the state nor the employers, ranging from those who stayed in the comfort of their safe, secure homes, to the owners of businesses of various hues, came to the rescue of these migrants. Now, since there is a close relationship between migration and marginality, the worst affected are Dalits, OBCs, minorities, women in all these groups, children in all these groups, and the poor in general. So the sudden declaration of the lockdown took them by surprise. And since the internal migrants included both interstate and intrastate migrants, the worst sufferers were interstate migrants. And now just to get a profile of these interstate migrants, well, it's a well-known fact that a significant number of these migrants have come to other states in search of livelihoods and better life prospects. So they come mostly from the poor, rural, and historically disadvantaged caste groups. So what they are going through, they have actually been living with, is what I call a multi-layered marginality. Well, as seen in feudal relations, economic and political hegemony, patriarchy, and an insensitive capitalist market-controlled economy that exploits their labor but is not willing to share even a little of the profit that they are making by using the labor of these groups. According to an estimate, migrant workers contribute 10% of the national GDP. And the major sectors using migrants are textiles, construction, stone quarries, mines, crop transplanting, rickshaws, cabs, fast food joints, security system, hospitality industry, street vending, domestic work. I'm only naming a few. There are, of course, many more. Now the lockdown, where everybody was told, stay safe, stay at home. Well, I always wonder what the word home means to different groups of people. For those, who live in what I call as the comfort zone. You see, the home may mean a safe and secure roof under which we live. We can, of course, buy whatever we want, cook whatever we want, notwithstanding the psychological and other hassles through which many people who are living in these confined situations are going. At least there is a home. But even the word home does not mean the same thing to everybody. So lockdown, you see, no doubt told us to be safe and secure at home. But you see, not everybody could afford that. So those in comfort zones stayed safe, but many of these migrants were ghettoed in closed conditions and did not get healthy food or fresh air or, even a preventive health care. So when the lockdown was relaxed, trains and buses were no doubt designated to take these people back home when they wanted to. A newspaper report that was published, when this process of movement back to their homelands started, said that the number of migrant workers who took the special designated trains as 60 lakhs, and the number of trains that went to different parts of the country were about 4,450. But what about the conditions in this train? When we talk of internal migration, that is why I said to talk of the whole group as if it's all, living in similar conditions is a basic mistake. What about the conditions of the trains and the buses? You see, we have in a hierarchical system, I think we have always lived in a system where, the hierarchy gets translated even in living conditions, traveling conditions, etc. So what, I don't know, the trains that took people, well, we always have this patronizing attitude when we behave and talk as if, giving food, giving packets and transporting them from one part of the country to another is a big favor that we are doing. But there were other issues, like what were the safety measures in those trains? People rushed. And what about the costs? There was a huge issue involving the state and the state governments and the center regarding this. And were distances maintained? What kind of facilities were provided? Of course, the state did make some arrangements, and I know that a few civil society institutions also chipped in. But, to talk of this migration back to their homes is not as simplistic. And I think that we students of sociology really need to make serious studies, micro studies, I would say, and use that as a base for not just COVID related policies, but for action in future. Now, another serious issue that relates to internal migration is the status of migrants when they go back home. In fact, there are studies and there are also discussions where people are talking about it. It's okay that they have left your place, but what happened when they went back? Now, quickly, I might tell you that you see Bangalore, for example, is under lockdown now, the last 3-4 days. They say it is going to last, till about 22nd, and there will not be a further extension. But when the lockdown was declared on Saturday, and they knew it would come into effect from Tuesday night, lakhs of people left Bangalore to different parts of the state. Now, the consciousness about COVID has grown so much that in many parts of the state, the migrants were not allowed inside. They were stopped outside their villages. And the Bangalore-Mysore road, you see, there was a kind of such a huge rush. And then everybody blamed them. People are talking as if, COVID has spread only because of internal migrants. But I don't think that's a situation that this needs to be discussed like that. This is a kind of what I call a top-down approach. Where do they go? There are no jobs in Bangalore. All establishments are closed. They have no money to pay rent because most of them were living in, small one-room kind of, accommodation. They are closed now because they have no rent to pay. Yesterday, somebody was telling me that in Mysore itself, after this pandemic situation started, there are several houses that are lying vacant because people have left and there is nobody to come. So I think a very important issue for us sociologists is to find out what is happening to these people. So livelihood, according to me, is something that should not be discussed only in terms of loss of livelihoods in cities, but loss of livelihoods back home also. The migrant group, I think we all know, for example, left their homes, many of them at least in a distress situation, and it is the same distress which is driving them back after COVID-19 uprooted their makeshift homes and took away their jobs. So one of the most threatening consequences of COVID-19 on migrants is the loss of food security. While those with resources indulged in bulk buying, This is what you're seeing in Bangalore now. The shops are open from 5 to 12. But buying is going on even at 8 o'clock or 9 o'clock in the night. So when somebody called me up and said, look at these people, the way they are rushing. They are going there at night because they work the whole day and have to buy little tidbits. They are not in a position to engage in bulk buying. So these are the migrant groups that came to Bangalore that, followed, their livelihoods were dependent on small jobs. And so even if they are working now, the money comes only in the evening or once a week or once in 3 days or 2 days, as the case may be. So, it looks as if they are the ones breaking the lockdown rules and spreading the disease. So this is a serious question that we as students of sociology have to ponder over. And now coming to the big question of, do the migrants want to return? As per a research study by Caritas, an organization that undertook this study in the 10 states of UP, Bihar, Jharkhand, Orissa, Madhya Pradesh, Telangana, West Bengal, Maharashtra, and Assam, supposed to be the 10 most affected states vis-a-vis the migration issue. This study found that only 29% of the migrants said they don't want to go back to the place from where they have gone back. There are other about 32% who are, who want to return provided the situation improves. And the remaining about 39 to 40% are undecided. So it means that we are not sure what is awaiting them. And of these, migrants, this study showed that nearly 90% had lost their livelihood base and 10% lost their family members. And talking of Narega, which is seen as a big savior, this study showed that only 6% of those who had gone back were able to find jobs, and about 40% at the time of this study had no job cards and hence could not go under Narega. Now, I'll just take about another 5 minutes. India's nationwide lockdown no doubt disrupted everyone in some way or the other, but it was a migrant group that was dislocated. Their livelihood bases were shut down, public transport withdrawn, and hence most of them had no choice but to leave cities. But how? While some waited for trains, buses to be organized, there were those who started walking. Images of the painful, arduous journeys will remain in the annals of COVID-19 history for all times to come. But again, as I said in the beginning, did they have a choice? While the class that could afford aeroplanes and private travel by private transport could do that. Actually, when the lockdown was lifted in phases, whether it was from outside the country or from other states, they could go for quarantine, either institutional or home based, live in protected conditions. What happened to those people who traveled in non-sanitized surroundings, lived in non-sanitized surroundings? The poor migrants were often left to fend for themselves. The government, we all know, announced a 3,500 crore food support program for the migrants. But as usual, the modus operandi for operating this program is still not known. We still do not know, because all of us are aware that they are at the mercy of the employer and not the welfare state. So what's going to happen? We are unsure. Now, while we are on the subject, before I close on this question of situation, I would like to ask this question about women in these migrant groups and children. Whether, they are there in this group as workforce or, as spouses, daughters, or mothers or dependent relatives, what is their position? Because when marginality intersects with gender, we know that the situation is further intensified. Whether migrant or non-migrant, rich or poor, rural or urban, gender stereotypes operate in families and hence also in migrant groups. So women are the ones who cook and dispense food, take care of children and elderly. And how are they managing these crises now? Besides pressures of female biology, patriarchal values and practices, and a system that creates spaces for sexual exploitation by gender insensitive, unscrupulous persons, women in migrant groups have had to face a lot of violence. There are already studies showing that when they have gone back home, they are completely impoverished. They are no longer in a capacity to earn. So there is a lot of sexual abuse. Just one more quick thing before I go to policy and then I end this. It's already come to light that many girls now are out of school, at least the migrant groups. It is said that about 40% of the children of migrant families are now without school. They have stopped studies because there were in most of the states arrangement for sending these kids to school. So they are with their parents. It must be happening in other parts of the country also, but in Karnataka, I know for sure, even in and around Mysore, child marriages are taking place. Complaints to police helpline have increased. And if daughters had continued in school, this would have been avoided. Now that they are with their parents, moving around and going from, the cities where they arrangements were made for their schooling. So this is another phase of the pandemic on which real research needs to be done. So now, one thing about situation, how do we deal with this? So migration is not a new phenomenon in India. It's a part of the process of both development and at individual and institutional levels, and contributes significantly to transforming societies. But migration is also associated with the most unacceptable treatment of the marginalized and vulnerable. Notwithstanding the opportunities that migration has created for people to aspire for and achieve social mobility, we should have what ILO once called fair migration policy. The biggest policy challenge is to counter the lapse back to poverty or falling deeper into poverty, which could be the immediate result of COVID-induced migration or loss of livelihood. So receiving them back with dignity, these are some of the things we could think of. Back with dignity, quarantine, regular medical checkups with follow-ups are a must if the stigma and fear associated with the pandemic are to be removed in communities where they have moved back. Now, to conclude, I say the biggest challenge for the state and civil society is reversing the downturn, that is, of course, the immediate task on hand, but the most difficult to achieve, I would say. So the priority of the policy is one, to bring back social dignity, and the other is to ensure that economic support is given to these families. And when I talk of policy now, I would say that it's not just the state, but the civil society. As the question is coming up here, what about academicians? I think I would end on that note by saying I've been talking about this wherever I've spoken on this. I say that we have something to give back. Even the academics may not be a homogeneous community. However, institutions and individuals who are in comfort zones in the academic world can share their knowledge, their resources, their institutional ambience to help those children, to help those women, to help those youngsters who require, some kind of skill development as well as skill upgradation. So I would definitely say, that the social security now, with the kind of costs that the state has incurred, they are, the policy again is pro rich, pro capitalists, and a plane can bring back people who are stranded there. And of course, whether you come with the kit or whether you wear mask or whatever you do, a plane is a plane and a bus is a bus and a train is a train. So those differences, like government quarters, why do we live in that mindset when we think that the poor, the vulnerable, the labor can always get away with the minimum of conditions? Why can't they have a right to life of dignity? I think this is a lesson we at least must learn now and start thinking. So all I say is people are talking about the Kerala plantation workers model, where many 50,000 to 60,000 plantation workers who are migrants from northern states did not go back because there were certain security measures in place. Perhaps with locally relevant conditions, this can be tried, I would say. But the fears, lack of support, all that needs to be dealt with. So, in conclusion, I would say that migrant support policy must include counseling, training in non-farm activities, use of indigenous knowledge, programs for skill upgradation, and also the involvement of the civil society in a very big way to actually help them, because it is their work. All of us are workers. Everybody is a worker. We all work for survival. So you cannot migrant. That's all. It is all our labor. Some of us are fortunate to stay where we are and give our whatever we have been able to learn, whereas they, for various reasons, are forced to use their labor without choice. So thank you very much for this opportunity. And it was nice being there. And I look forward to learning a lot from this. Thank you. Back to Dr. Jai.
Thank you so much, ma'am, for your thought-provocative lecture as a chief guest. And I feel that you and Professor Paramjit Judge, including a guest of honor, Professor Rajashekhar, particularly have focused on the themes which will be discussed in the parallel session, and more importantly in the plenary session, because you have touched, Paramjit Judge has talked about how the refugees are the most affected, and how in the context of diaspora, how the low paid occupation workers like nurses are the most crucial ones who face the brunt of this pandemic, since they have to work in multiple places, work among the old aged people who have low immunity. And he also talked about how Indian government thought that this lockdown may last only for 1 month, but it is beyond that. And he raised very, very important questions as to how the civil society organizations and religious organizations like Gurudwara intervene to help these migrant workers in various ways at the micro level. And also lastly, he talked about how state governments impose certain rules not to allow these migrant workers to pass through their states. And ma'am, you have touched upon the situation of the internal migrants in a very important sociological perspective, in the sense that you mentioned how migrants are not homogeneous, and you also talk about the important issues of how the conditions of these migrant workers were while traveling, and also at the point of their destination in their villages and towns. And I think one of the takebacks from ma'am's lecture is that how children and women are the most affected group. And I'm amazed as to how you brought out the figures very beautifully from a well-researched group. 40% of children are out of school. And in the context of migrants, you mentioned how 29% of the migrants do not want to go back, and how around 32% only wants to go back. And the rest, approximately 40% of the migrant workers, are not sure what they want to do. They can't say whether they will return or stay back in their place of origin. And I think the most important thing that you pointed out is the way how sociologists should look at this whole thing as a top-down approach. I think earlier we talked about a bottom-up approach, and now today I think we need to look at the top-down approach from a sociological perspective. And also, lastly, you talk about restoring the dignity of these people. So thank you so much, ma'am, and thank you, Professor Paramjit Judge. Thank you, Professor Raja Shekhar, our Pro Vice Chancellor.